Hello, I'm Dr. James Bogash, expert in health and longevity, and as a practicing chiropractor, these next three articles definitely hit home with me. And this is obviously can be a potentially controversial subject, and definitely I have my biases. But one of the things to understand, and I get this a lot on social media all the time, about basically I'm a chiropractor, so what the hell should I know about anything that has to do with the human body? And the reality is that chiropractic care is not a procedure, and most people think that they equate chiropractic care with the adjustment, and that is the biggest mistake. And maybe 100 years ago that was accurate, but today chiropractic care is it's a health profession, and we have a different view on the way things work. I would much rather try to attempt natural approaches to healing, regardless of whether it's musculoskeletal or something else, as opposed to drugs or surgery or injections. It's not that those things don't have a place, but they are way overused, and many times natural approaches can come first. So we're going to start with the first of these three articles, and it has to do with so back to, I mentioned my opinion is clearly biased. However, that bias is also informed by lots of reading on this particular topic, and you'll find, I'll point out that most of the research is, if not all of the research, is in line with what we're seeing with these studies. So this one was a study out of University of Utah Healthcare System. 85,000 participants with a spine or extremity or an arthritis diagnosis. So basically pretty much any musculoskeletal problem. 3,812 made it to physical therapy. Out of the PT patients, the ones who chose of the 3,800 that saw PT, they had a 24% higher risk of getting an MRI and 11% higher risk of ending up in surgery. Now, you would think that these, PT would the goal would be is to be more efficient with the care and have better outcomes. I'll explain at the last slide why this is likely the case. The next study had to do with 195 Medicare patients, and they compared manipulation, which is generally done by chiropractors, right? Something like 95 and 96% of the manipulation is done by chiropractors. So when they say chiropractic, or when they say manipulation or spinal manipulative therapy, SMT, generally we're talking about chiropractic care. And they compared it with drugs for back pain. Now that can be, back pain includes anything along the spine, generally low back pain, but it can also include neck and mid-back pain. Of these 995 Medicare patients that saw a chiropractor, 84% were satisfied with the treatment that they got. On the flip side, only half were very satisfied with the drugs that they receive. A lot of times that's because they're just not effective or they have side effects, and that certainly plays a role in people's satisfaction. The other thing is that manipulation patients had a higher quality of life score. So not only were they happy with their care, but their quality of life improved with manipulation over the use of drugs. So, you would say, well, great, like they're happy. Obviously, chiropractors spend more time with their patients. We generally have a better relationship, and we'll see patients more frequently than they might see their primary care doctor. But what if we compare the same standard about escalation of care to MRI, surgery, and injections? Well, this moves on to another study of 10,372 patients with back pain, and 24% of them initially were treated with spinal manipulation. 4% were treated with delayed manipulation, so they saw somebody else first and then were referred for I would suggest chiropractic care. 72% no manipulation was used, and this is the problem we have in society, because all too often, in this case, almost 3/4 of the people with back pain did not see a chiropractor first, and that is generally a pretty big mistake, because what we ended up finding was in care escalation to either imaging, injections, or surgery, 30%. That care escalation was 30% lower when manipulation was used first. If it was delayed, it was 22% higher. The thing that makes this even more of a supportive result is that we've seen this with other studies. Optum Healthcare, a subsidy of United Healthcare, did a massive study and found that ultimately if they were to steer all care to chiropractic for initial treatment of back pain, the savings would be in the billions per, I want to say there was 3 years to the study, but this idea that chiropractic care is a increase in cost just does not fly out when you look at the research on that. And the only way that this happens is if chiropractors in general have a different approach to treating the patient. We're not talking about a treatment, we're talking about an approach. So while manipulation may be a primary tool, much like drugs are a primary tool in a typical primary care doctor's office, the reality is that the attitude is different. So if, as a chiropractor, if I can use evidence-based medicine to order imaging when necessary, only refer out to injections if somebody is not responding to what I do, and surgery is obviously the last outcome, and I'd be lying if I said that patients in my office all respond at 100%, nobody gets referred to surgery or injections. That's not true. However, the numbers in our offices are quite low, and so this, again, just supports with what we see in this study. As always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.